All right, hello, Professor. Today I'm going to walk you through my career planning assignment sheet that I did. So, first of all, I use the Career Center and ONET especially to find my second source and to find information about my second job, and especially to find information on my first career. So, my first career that I am planning on doing is being a physical therapist. The description: they help their patients improve their movement, recover from injury or major surgeries, manage their pain, and help with end of their treatment plan to get their body back to feeling normal and ready for normal use. This is like things after like knee surgeries, shoulder surgeries, a lot of major ACL or like for sports, especially any major injuries that are usually season ending. A lot of times these athletes will go through a major recovery plan to get them back to the fitness shape that they need to be in to perform at their highest level. The education required, it takes about 6 to 8 years. You must get a bachelor's degree, become a doctor or get your doctorate in physical therapy through grad school. You have to have a certain number of clinical hours, and you have to get licensed by the state. Related education skills that I have, I've completed the training to be a physical therapy technician, and use all of the machines and all the resources that a physical therapy office has. And I also spent time interning in an office. I'm also currently in school for my bachelor's degree in exercise physiology, and I've begun taking science courses for this field, and I plan to go to grad school. So the average salary is a little over 100,000, and the type of experience that helped me obtain this career is internships at physical therapy offices like the one I had, uh, or like working as a technician like I was, or a physical therapy assistant if you can get that job as well, or having experience as an athletic trainer would also help. My interest on a scale of 1 to 10 is a 10 because it's something I've been thinking about doing since probably my freshman or sophomore year of high school. And it's a very practical fit because there's a lot of options and I have a lot of connections, I feel like, in this field, just being at U of L with U of L Health and the connections I made previously at my internship. So my next steps for this career would be to continue to take my science classes and finish my bachelor's degree, and then move on to grad school somewhere. Um, and I should also try and start getting a head start on my clinical hours as well, especially at U of L, either at U of L Health or with my other my where I interned at near to where I live. And I should also talk to people in similar fields and find ways that I can like find learn about things that they did to get into this field and be better connected in that way. Um, yeah. All right. Moving on to my second career field that I learned about is being an occupational therapist. An occupational therapist helps people of all ages recover or learn how to do tasks and things that are needed for their everyday lives or careers. The people they help that have struggle with these tasks is because of injury, disability, or illnesses. So they could help children with disabilities, learn to talk or read or write correctly, or they could help someone who was injured in their career field or had to have a major surgery, or had something like a stroke or other type of medical injury or illness like that. Relearn how to do their job or work in their field so they can continue their careers as people in the society. The education required, again, about 6 to 8 years. You need a bachelor's degree in a similar field like the one I'm taking, a graduate program, field hours in the work area you plan to, because there's so many different areas you can work in, such as like a school, as someone that I know who works in a school teaching kids and things how to focus or how to read or write better or how to speak clearer, like things like that. Um, and then you have to get certified by the state you're working in again as well. Education skills that I have. I'm in school for a bachelor's degree right now that would count. Like I said, I have a few college credits that have already been before college, and I have weeks of experience as a technician for physical therapists. And physical therapists also kind of relate to this because, especially if you're being an occupational therapist for the older demographic of this field, it's a lot of times recovery from injury or surgery or illness and helping them regain abilities to do their regular things through their life and jobs they have. The average salary again is a little over 100,000 for Kentucky. type of experience. A lot of experiences that would help with this is working with people, especially and physical therapists. A lot of times will do both this and become an occupational therapist. I know a couple that were physical therapists while they were going to school because they thought they'd like occupational therapy a little more, just to switch and see if they'd like it more because they were more interested on doing that and helping in that kind of field. Um, my interest isn't 8 because I want to do physical therapy, but I feel like I would also be good in this field as well, and it's definitely something that I could relate to. It's very practical as well. It's also a 7 out of 10 because I know a lot of people, or I know some people that have this field that have this job. They're mostly teachers who work in schools, and they just help the children, like I said, learn how to read, write, speak a little better. So my next steps would be finishing out my undergrad and then going to grad school to get my education. Find companies and stay connected with U of L Health and any programs they may have to help me with my hours, my field hours in this field, and then talk to my family friends, like I said, and maybe get field hours with them, or just learn more about what their specific jobs are in their fields for occupational therapy. In my reflection, both of my career paths are great options for jobs that I would want to do and see myself doing for the rest of my life. I feel like I'm leaning currently more towards physical therapy because I have some experience directly in that field and I know about like the setting and what the day to day operation looks like, opposed to occupational therapy. And U of L, there are a lot of things I can do to help me reach my goal sooner. Like we talked about in class, I can currently start trying to get my clinical hours at U of L Health, and they can even pay me for some of them as well, especially over the next couple years before I get into grad school and I'm really, really busy with the harder classes and things. Um, I feel like my biggest hurdle or challenge through this whole process would probably be the money in reaching grad school and things like that because currently I'm working at UPS to help pay for my schooling, and the program I'm doing does not continue into grad school, which means I would have to save my money or take out a certain amount of loans to help pay for grad school. And I feel like it would be worth it, and it's definitely possible for me to do. I just have to really focus, really make sure I'm saving my money and being smart financially. And it would just definitely be the hardest part of this journey for me to become a physical or occupational therapist. Thank you.